There is a viral illness that many Nigerians thought was slowly fading into the background. Something we've battled almost every year, but it never really goes away. Just when we think we have seen the worst, it finds its way back into the headlines. So today we are talking about Lassa fever, and the situation has once again taken a tragic turn with new deaths and a worrying rise in cases. Health authorities in Benue State have officially declared a Lassa fever outbreak, with 56 suspected cases already recorded as of early February. At the same time, Plateau State has confirmed at least 11 cases with 4 deaths across 7 local government areas of the state. Now, this isn't just a few isolated reports. It's part of a seasonal resurgence that usually happens around this time of the year, when disease becomes more active and harder to control. What has made this outbreak especially heartbreaking is the death of a health worker who was trying to save others. In Plateau State, a medical doctor, Dr Salome Oboyi, died after she contracted Lassa fever while treating a patient. She worked at the Benue University Teaching Hospital in Jos, and according to reports, she was exposed to the virus in the course of her duty. Her death has sparked outrage within the medical community, with the Nigerian Association of Resident Doctors condemning the healthcare system for what they described as chronic failure that exposed frontline workers to deadly infections. They've called for better protective equipment, stronger infection control measures, and real support for health workers who put their lives on the line. So why is Lassa fever back in the news, you may ask? Nigeria records cases of Lassa fever every year, but it's a disease that never really goes away. For all of 2025, the Nigerian Center for Disease Control reported hundreds of confirmed cases, with over 200 deaths across many states. The virus is carried by rats, especially the multi-mammat rat, that is, those species that have multiple breasts, like a lot of breasts. And people usually become infected through contact with food or household items contaminated by rat urine and droppings. It can also spread from person to person, especially in hospitals where infection control is weak. Now, when outbreaks peak, symptoms can include fever, weakness, vomiting, bleeding, and in severe cases, organ failure. Early treatment can help, but many people don't get to the hospital soon enough, and treatment resources are limited in many areas. Now, the reality is that Lassa fever is still endemic in Nigeria, and every dry season, roughly between December to April, provides conditions that make the disease more likely to spread. What's happening now is a reminder that the fight against viral outbreak isn't over, even as we've gained experience from other pandemics. And while the general public tries to stay safe, health workers are on the front lines, sometimes at great personal risk. That is why the news of a doctor dying after treating a patient hits us so hard. And we are, however, advised to keep our surroundings clean, properly store our food in sealed containers, and reduce contact with rats, which are known to carry this virus. Now, open food, uncovered leftovers, and poorly managed waste all increase the risk. Also, regular hand washing with soap and water, especially before eating and after handling food or household items, is advised. For healthcare settings and caregivers, the emphasis on strict infection control is needed. The use of gloves, protective equipment, and proper hygiene is critical because Lassa fever can spread from person to person through bodily fluid. If somebody develops symptoms like persistent fever, weaknesses, vomiting, or bleeding, they should seek medical attention immediately and avoid self-medication. Health authorities stress that early presentation at a hospital can save lives. Staying informed, staying cautious, and taking symptoms seriously, that is where this story leaves us. Thank you so much for watching this episode of So This Happened. My name is Muyoluwa Olatide, and I will see you in the next one.